Ang anterior cruciate ligament injury o pagkapunit ng litid sa tuhod ay isa sa madalas na injury ng mga atleta. Ilan sa mga high-risk sports na nagdudulot ng ACL injury ay ang sports na soccer, football, skiing at basketball. Sa katunayan, ilan sa mga Filipino athlete ang nakaranas nito, tulad ng PBA players na sina Larry Fonacier, Dondon Hontiveros, at Chris Banchero. Maging ang Adamson point guard at Gilas Pilipinas player na si Jerome Lastimosa nagkaroon din ng anterior cruciate ligament injury. Atleta man o hindi, walang kasiguraduhang ligtas sa knee injury na ACL. Kaya naman pinapayuhan ng lahat na mag-ingat at palakasin ang tuhod.
Sa mga manlalaro o players sa mga barangay liga o summer tournaments, makinig po kayo dahil this morning bibigyan po namin kayo ng tips kung paano may iwasan itong knee injury na maaaring mangyari sa kahit sino pa pong mga manlalaro, lalo na po sa mga nagbabasketball, volleyball o kahit ano pa pong laro na inyong ginagawa.
Tama yun. And this morning, makakasama naman natin si Dr. Carmelo Braganza or aka Dr. Bragi, na isang orthopedic doctor. Hello, good morning.
And sports doctor also.
Yeah.
Sports
Good morning.
doctor. Ang dami actually, no, na pwede nating i-mention, right? You're a triathlete, right?
Triathlete physician.
Yon, triathlete physician. Wow.
Doc, ano ba itong ACL? Pwede bang, kasi lagi nating naririnig, lalo na sa mga basketball players. Ako usually naririnig ko siya sa mga basketball players. Ano ba
Yung
itong
anterior cruciate ligament.
Yeah.
Wow.
The anterior cruciate ligament, it's ano po siya, litid or ligament between the thigh bone, yung hita, at yung leg bone, which is the tibia. So the anterior cruciate ligament, it's the
Sa
one
knee?
in between. Yes, it's
Okay.
inside the knee joint. So siya yung primarily nagpre-prevent ng too much excessive movement ng tibia forwards. So if you do tear it, it can be debilitating and it can be very difficult to mahirap makabalik sa sport kapag punit po siya.
How do you punit it? Wow, how do you punit?
paano siya mapupunit?
Paano mo siya i-damage, Doc? What
Yeah.
are the things that cause that sa isang
So the
player o isang
usual
tao?
damage for an ACL, anterior cruciate ligament or ACL, is it's typically a non-contact injury. So it means the player was not hit, but it was an awkward movement where the leg is planted and then it collapses.
Na-twist lang.
Yeah, sort of a twist. And then in that position, it can be injured, and then usually it's a pop. There will be an audible pop by the athlete, and then when that happens, the knee might swell up, or and then they'd feel that there's something terribly wrong with their knee.
Pero Doc Bragi, kung sabi mo, twist lang siya, no contact, pwede mangyari kahit hindi athlete.
Yes, it's very possible for people who are not non-athletic or do not participate in sports. But the common thing is if it is ano po siya, an awkward position or an accident.
Like yung mga elderly ba? Are they susceptible to
An
having?
elderly individual may get an ACL tear, but usually they end up with a fracture kaysa a ligament injury like an ACL tear.
Sa ACL, meron din yung iba't ibang levels, Doc. Ano ba ito?
When we talk about levels of injury of the ACL, because sometimes you'll have your doctor request an MRI and then they'll check on it, then they will say there is a sprain. So typically a sprain, ano po siya? There are different grades. One is grade 1, grade 2, and grade 3. The grade 1 is it's partially stretched. And then grade 2, there are some fibers that are torn. And then the third, which is the worst type, you have complete disruption of all the fibers.
So, hindi mo na siya kayang magalaw?
Hindi mo siya
Ganun ba yun?
ma-fold?
Magugulat po kayo, no? Because someone with an ACL tear, they can still do sports.
Normal.
After.
Wow, okay.
But the issue would be, they end up meron pong alog yung tuhod. There's an instability. Yeah. So speaking from experience, I've had an ACL tear. I had my knee fixed as well. So after my injury, I did play basketball with a torn ACL, but there were times that my knee would give way.
Paano nangyari nito, Doc?
Doc, grabe ka, Doc.
I was playing
Go.
football. Then awkward side
Football.
step. Yeah,
Ay,
football.
familiar
Soccer
ko dyan.
po.
May
Pero
bike that plays football.
nung nangyari sa iyo, Doc, sorry nung nangyari sa iyo, may narinig ka kasi sabi mo, meron kang
May
narinig
pop
na,
eh, di
may
ba?
pop.
Sabi.
Oo.
Yeah.
And then nagagalaw mo pa, normal.
It will be painful for a few days, but then once you have normal walking, like for the typical patient, ang gagawin nila, they'll try jogging again and moving.
Ano yan? Slowly ba muna,
Yeah.
Doc? Or
It's
kasi
about-
kayo po, nakapaglaro pa.
Yeah, it's about a week or two from the initial pain and the swelling that they have. And then after that, they can try doing activities. But then the residual issue would be, there would be that sort of translation. There would be this excessive movement.
Ala,
So
it's
that
so painful to hear.
Yeah, it's very uncomfortable. It's something that what most patients will come to me for, that they did have an injury and they would want it fixed because they feel the instability.
Now, Doc, how do you fix it? Is there a physical therapy that you have to go through?
surgery?
Initially, physical therapy is something that can be done. For those who are not high demand and we expect that maybe they're not good candidates for surgery, hindi po natin na opera ka agad. So usually you'll tell them exercise program, referral to a physical therapist. Pero once for surgery, these are for our younger patients, those who play for sport, yung mga mga student athlete, professional athletes, because if they have a tear, and then they do have signs once they get a checkup with their physician.
Anong signs yan, Doc?
Instability. Pag
Yun.
umaalog yung knee or some persistent pain or discomfort.
Question,
Yeah.
Doc. Is this like itong na nire-represent natin, is that collagen? What is that made of?
no,
I just want
collagen
to
is-
understand from the bone
Yeah,
to the ligament,
yeah.
what is it?
So collagen makes up the tissue that we have. So bone has one type of collagen. The tissue in between the knee,
Correct.
ito, this is the cartilage,
Yep.
fibrocartilage, the meniscus. These are the ones that are made up of a different type of cartilage.
And how
collagen.
does our body produce that? Kasi I would like to know kung meron tayong dapat kinakain or ina-avoid lang para hindi mangyari yun.
Not really with foods, but if you are prone to having high, let's say, sinasabi nila uric acid.
Ayun,
Yes.
oo, mga ganyan. Oo
If
nga
you're
eh.
not predisposed to something like that, then it's okay to eat yung mga beans and meat. But then if you do start having pain, maybe it'd be a good idea.
To
bawasan lang
bawasan yung mga
usually
ibang
the
food.
red meat, something like
Eh,
that.
Doc,
Mga
totoo
masarap.
ba na, na kadalasan mga kababaihan yung nakaka-experience ng ACL?
Oh, yes, there is some truth to that. Actually, the ones who have it a lot are your younger athletes who are female.
Why kaya, Doc?
Interesting, why?
Yeah, actually, you can blame the biomechanics of the body, the way women have wider hips, their knees are sort of more knock-kneed kaysa sa
Yeah,
kanan.
correct.
And then there are other things that we have to take into consideration. Yung mga lakas ng muscle sa
sa
hita, tsaka sa likod.
What about wearing heels? Kasi pwede matapilok yun. Oh my.
Yeah, but,
May gano'n na bang, meron
May
ka na
mga
bang gano'n na,
ganun ba, Doc? Meron,
wala
wala
pa.
pa.
Patient.
May isang beauty queen, no,
Yeah.
na it happened before to
Yeah,
her.
pero ano,
Which is very seldom,
because
right?
of sport also, ski
Sports,
naman.
ayun.
Pero sabi niya sa akin, Doc, ang kwento niya, at first, parang hindi niya alam na masakit na pala, parang normal, siguro dahil malamig din, di ba? Parang nadapa lang siya, and yun pala, nung nagpa-check na siya, kasi nakaka-feel na siya ng discomfort for like a week, so nung nagpa-check siya, for surgery na pala.
may nakita niyo.
Paano mo malalaman, Doc, na you're a candidate for surgery na sa ACL?
So usually it is with the symptoms that you feel, persistent pain, persistent instability, yung difficulty returning to sport. You cannot do sport because of the discomfort. And then we can do some imaging. So usually the basic imaging is just a simple x-ray to rule out a fracture. And then later on, if persistent yung pain, not improving with physical therapy, maybe you'll do an MRI.
Gano'ng katagal yun, Doc, for
Which one?
them to recover? Halimbawa, ikaw, Doc, di ba, you've
Oo nga, na-experience mo,
Oo.
Doc. Oo.
Matagal na ako na-operahan eh.
Pero gano'ng katagal ka naka-recover for your...
It took me a long time because before, with all the progress, with all the new information that we have in technology, before we'd say the faster you return to the sport, the better, and then everyone was trying to prove that you could do it faster. So my recovery was actually at 6 months.
Oh, but, Doc,
Yeah.
can you still experience? Can you still have
Oo
ACL
nga.
after
Could it
mo magkaroon ng
happen
ACL?
again?
What's that again?
Pwede ka pa bang magkaroon ng ACL kahit na na-operahan ka na?
Oh yeah, it's very possible. Actually, those who have ACL tears have a higher chance of re-injuring themselves. That's why they really have to kailangan alagaan talaga yung tuhod, tapos kailangan talagang mag-prepare, you do your adequate warm-up and preparation for sport.
One thing din siguro, Doc, yun yung hindi nakakapag-stretch before they do the sports. You think malaking factor yon, Doc?
It is a factor po na if they do not stretch. But the more important thing actually for everyone is to do warm-up, proper warm-up. Because if you're doing your warm-up, then your ligaments, your body is more limber, mas madaling mag-stretch po. So the more important thing for me would be to do an adequate warm-up. At least mga 10-15 minutes. Yeah.
Tapos sa mga nagkaroon na ng ACL before, malilimit ba natin yung mga exercise na gagawin nila after yun? Kayo, Doc? Nalimit mo
Doc.
ba yung sa inyo?
Meron ka na bang mga hindi na nagagawa mo
Yeah.
before?
Even if I do ACL surgery, I try to tell my patients that they can get back to some level. After I got my surgery, I actually did quite a few sports. So, and I still play basketball.
Nice.
So I still play basketball. I think I still do it well because I know what to condition.
Pero may nakita ka
Yun,
na
no?
bang difference, Doc? Kasi
Yeah.
after the surgery,
Yeah, there are
meron
some
na.
differences.
Ano yun?
When you do surgery, and typically the return now, just to emphasize to the audience, no, that return to sport, the longer return to sport, the better your outcome. So meaning, don't rush things. A lot of our athletes are impatient kasi to get back to what they do.
Yes.
But they have to understand that the recovery process, your body is healing. So it takes at least 9 months sa recovery.
To recover.
Yeah.
Matagal din naman, no?
Doc, ano
Ito,
na lang
Doc.
yung advice mo sa mga athletes o kaya naman sa mga...
Mga kada lang natin.
Kada natin. Kasi nga, kahit
mahilig
hindi ka
maglaro sa
athletes,
labas.
Oo, kahit hindi ka
Oo.
athlete, pwede ka magkaroon ng ACL.
So generally for your young athletes, our young athletes doing sport, is adequate warm-up and conditioning. Don't rush into things. And then if you have an injury, get back to sport slowly.
Okay.
No? Oo.
Dahan-dahan,
Yeah,
mga
and
kada.
also, other thing would be your cross-training. Do other exercises, not just that single sport.
Paano, Doc, kunyari hindi naman ako mahilig sa sport? Pwede bang magkaroon pa rin ako ng ACL na parang hindi siya na-exercise lagi? Alam mo yun? Kasi may mga kada tayo hindi mahilig mag-walking, mag-jog,
Bigla
diba?
halimbawa, meron ka ng dance with sex bomb finally. Ayan tuloy, nag-jump ka.
Oo, parang
Ano yun,
mabibigla.
Doc?
Yeah, if you get back to sport or you have to do something, break into it. Don't do things suddenly. Our worst enemies are doing things too fast, too soon, and
Actually,
you know,
oh,
yeah.
moderation
Yeah,
lahat. And
moderation is the
dahan-dahan
key.
lang tayo, mga kada.
Kaya naman sa mga gusto magpa-consult sa'yo, Doc, saan ka ba nila pwedeng mahanap?
Oh, I work at UST Hospital, St. Luke's Global, De Los Santos, and Veterans Hospital.
Do you have social media accounts you would like to share with us?
I have an Instagram. It's Dr. Bones PH, Dr. Bones PH on Instagram, and on Facebook, it's Dr. Carmelo Braganza, Orthopedic Surgeon.
Thank you very much, Dr. Bragi. At mga kada, see, dahan-dahan po, pag may nakaroon po ng ACL dyan, huwag agad-agad nating gamitin yung ating mga ligaments dyan because baka mamaya mas lalo lumala na lang yon. Kaya dahan-dahan po sa pagbalik, sa pag-exercise. If meron po kayong history ng ACL, iwasan din natin yan, okay?
Hi, mga ka-Net 25! This is Emma Tiglao. For more Kada Umaga updates, just click the subscribe button and follow us on Net 25 social media pages at Net 25 TV and at Net 25 Entertainment Facebook page.